I'm going to try and keep this very complicated topic as simple as I can. When you start talking about health insurance, it can get really confusing because there's a whole bunch of different factors. I'm going to talk about two main ones that hopefully will help you guys out if you ever find yourself in a position where you have a job that provides you some sort of health insurance benefits. The two big words that I need to talk about are copay and coinsurance, okay, or deductible and coinsurance. So if you have some sort of major procedure, something that's really going to cost some money, you may have to pay a deductible on that. So basically that means you have to pay this dollar amount before your insurance starts paying part of your bill. So the higher your deductible, the more you're going to be out of pocket. Okay, so you might have a $250 deductible, which is okay. My deductible sucks. It's like in the thousands of dollars. Like it might cost me $1,500 if one of my kids has to go to the hospital for something before my insurance ever starts paying. It sucks. It's just kind of the reality of things. So let's say we have this procedure at the hospital. We have to come up with $250 before our insurance starts paying. Now, after that, you may have what's called coinsurance. That means that that dollar amount past that 250, you might have to pay a percentage of that. My current insurance that I'm on does not have that. So after I hit my deductible, my insurance just pays. But my deductible is pretty high. So if you have a low deductible, you're probably going to be susceptible to this coinsurance clause. And I'm just going to show you how those two things work together and how the money is actually paid out for any sort of claim you have on your health insurance. All of these are pretty drastic scenarios. Like you're in the hospital and it's costing tens of thousands of dollars. Okay, this isn't just I went to the doctor because I have a cold and they gave me an antibiotic. It's not like a doctor's visit. This is more like a hospital stay. Okay, so what we're going to have to figure out is how much money did the insurance not pay, and then we're going to take our deductible off of that so we know how much we're responsible for with our coinsurance. Okay, it sounds. Whoops, this is. Let's get rid of this. It sounds really complicated, and it can be. Like I said, I'm going to try and keep this basic so you have some idea what's going on. So, Brooke has insurance that includes yada, yada, yada. Her major medical policy has a $250 deductible and 20% coinsurance. When she had surgery, her total bill for the hospital care and physician's fee was $9,350. The hospital and surgical medical provisions, basically her insurance, covered $6,825. How much does she have to pay? So part of this bill was not covered by her insurance in any way, shape, or form. Okay, so the total bill was $9,350. Her insurance covered $6,825. So Brooke is on the hook here, $9,350 minus $6,825 for $2,525. Okay, now part of that is her copay. So this dollar amount wasn't covered by her insurance, so she's going to have to pay $250 for that. Okay, so 25 minus 250. Her, excuse me, her insurance. I'm sorry. After her copay, right? There's still $2,275 not paid, covered by her insurance. So this part here, we're finding the coinsurance amount. That is her 20%. She's going to pay 20% of that $2,275. So 20% of that is $455. So when it says the total amount paid by the patient, she had her copay and she had her coinsurance. So she's paying $705 out of her own pocket. Okay. It seems like a lot of math. I realize that, but basically it's what's not covered wholly by her insurance. And then you're figuring out her deductible portion and then her coinsurance portion. All right. Same thing. We get rid of that here. Krista has a medical bill of $46,300. Her insurance covered most of it. That's what you would hope with insurance. So $46,300, $44,850 is covered by her insurance. So there is a little less than $2,000. $46,300 minus $44,850, $1,400 out there. All right, the insurance did not cover. All right, so her policy had a $200 deductible. So her co-insurance is going to kick in for the last $1,250. She's got 20% of that she has to pay. So another $250. So she has to pay out of her own pocket $200 for the deductible and $250 for the copay. So Krista's going to have to come up with $450 for her surgeries. So, like I said, I'm just trying to you get familiar with what a deductible is and what coinsurance is. Those are the two that you probably need to know the most. When they start talking about copays and stuff, that's a little bit different. That's what you have to pay out of pocket, like every time you go to the doctor. Like I have a $50 copay every time I go to the doctor. I have to pay them $50, and then the insurance covers the rest. That's completely different. But this isn't too bad. You're looking for two things. You need to know the deductible amount and how much they have to pay for the co-insurance. And add those together. That's going to be what they are having to pay out of pocket is the phrase.